So our next speaker is Amanda Woods, who's a registered nurse with over 40 years, no, nearly 40 years of clinical nursing experience. She's employed, they did cover, so employed in both paediatric and adult care, but she has a passion for observational research projects, and she'll be talking to us about are nurses placing themselves in danger from crushing medications. Thanks, Amanda.
As we know, I'm going to talk about the dangers of crushing medications for nurses and whether, from our paediatric study, looking at the data that we collected and what we observed, and when we've looked at the records after. Noting that we observed, I'm sorry, my slides are going to be a bit slow because I've got Adam put the animation on, 5,137 administrations with 2,863 being for oral drugs, 827 for enteral, and the number of medications crushed was 395. And what we're looking at is the safety of those crushing medications. We observed oral and gastric tube medication administrations for their method of preparation and administration. When I'm talking about preparation, how were they prepared before they went to the bedside? We observed whether they were swallowed, chewed, crushed or dissolved, and then we recorded them in the POSSUM software that Magda was talking about earlier today. When we look at crushed medications, we notice that there was 395 crushed medications of 72 different drugs. We used the assessment, we assessed the drugs using the Australian Don't Rush for Crush guidelines. That was the hospital standard to use to determine whether a medication should be crushed. 98 medications were listed with a warning in the guide that there was a hazardous warning for if we crushed, to think about it as part of a clinical practice. Of that, we note that 24% of the drugs we observed crushed had a warning attached to them. What does that really mean? What we know that crushing of medications has 3 types of occupational exposure hazards. Cytotoxic hazards, because we know they're dangerous they don't differentiate between normal cells and cancerous cells. We also have what we call non-cytotoxic, those that are hazardous to staff but don't actually have cytotoxic properties. Then we have the productive hazards. These are risks to people exposed who want to fall pregnant, who are pregnant, and those who are breastfeeding. So it leaves me with a question, right? Our reporters reported back, right, that they didn't actually record the safety mechanisms, and I was one of those observers who did this. So what we know is these are the 12 medications that were crushed. Right, this was the list that we saw. Right, noting that on this, risperidone was listed in the handbook with a warning, but it has now been removed in the latest edition released earlier this year than when we did the study. If we look at my graph, these are the 12 drugs, noting that the oral are in the red and the enteral are in the pink. They're very small in number because we only had 98 that were crushed with a hazard warning, but significant is spironolactone and tropimate, both oral and for enteral administration, were the highest numbers crushed. So it raises the question, what are these warnings? In the hazard book, in the Don't Rush for Crush, these are the different hazard warnings that come up. There are 5 different ways it's written across the non-cytotoxic drugs. And particularly, I want to draw your attention to the last one, which is actually starting to use the new standards that have been put out by ATAGI by listing things under occupational exposure risk categories. Occupational exposure may be harmful. Wear a mask and gloves if crushing or dispersing the tablet. Do not crush or disperse the tablet if you are pregnant. They're becoming much more specific than just saying, don't handle. They've become a lot more detailed. So in our study, what we note is that we noticed that the pharmacist wrote hazard warnings for cytotoxic drugs. We noticed that on review, no warnings were provided for other hazardous medications on the EMA system. There was nothing written. And this is an example of a chart where they tell us how to crush the drug, volume of liquid to use and then what to give, but they don't actually mention for this tropramate that there was any warning for the exposure for the staff. So from this, we can actually see, it really asks me the question, if we only give nurses some of the information and not all the information, are they making an assumption that that's all the information? The pharmacist has told me something, so this is all what we need to know, and they won't go and look up the warnings. And so should we be putting the warnings there, or should we be putting some other information to inform them that there is a warning? So this is my recommend, what we've come up as a team, and we've reported this back to the steering committee, and there has been change with this, is that ideally include safe handling information with the prescription. So when you actually put the name of the drug and the route of administration, it auto-populates. There's an occupational exposure warning, particularly for the non-cytotoxic drugs, that we include the hazard warning signal on the actual prescription as well as an alternative, so that people will know, hang on, there's a risk, let's go back and have a look at the guide. Or you have to ask, could we include a hyperlink on there to the actual page? When we choose the route and we know that there's actually a hazard, could we put? After we fed back to the staff, there was a recommendation added, and as you can see it on the example there at the bottom, telling people to wear masks and gloves. When I did the talk on Monday as a practice with the others, I said there was 5,000 drugs given, and we observed. And the farmer said, well, we ain't going to write it manually each time. We have to have a solution come up that's automated. So ideally, and it's not just paediatrics, it's across the thing. So crushing medications may result in aerolisation of particles. And these may be inhaled or come in contact with the health worker. So we need to come up with a solution to address the important role of the hazardous nature of medications to nurses administering them. Thank you.